Hello, children. That flickering is really starting to annoy me. Um, Today, we're going to do a couple chapters. We've talked about tobacco and what it does to you. We talked about alcohol and what it does to you. Now we're going to talk about using medicine responsibly, and we're going to talk about illegal drugs. So, page 234 in the book. This is 9.2. 9.1 was alcohol. Quick write. It says, write down a list of medicines you see advertised in television commercials. What are the symptoms or diseases we'll treat? Again, we're not going to do the quick write. We're going to talk about that. We're going to learn about how medicines help you when you're sick, why medicines have warning labels, how to use medicines safely. I think you guys take notes on words like medicine, prescription medication, over-the-counter medicine, antibiotics, side effects, tolerance, drug misuse, drug abuse. Chapter 9.2, Using Medicines Responsibly. How medicines help your body. Medicines are drugs that are used to cure or prevent diseases or other conditions. Again, I would put that in your notes. There are two types of medicines. Prescription medicines that can be sold only with a written order from a doctor. Over-the-counter or OTC medicines are medicines available without a written order from a doctor. I put those in your notes. Prescription medicines generally require a doctor's supervision because they have more risk than OTC medicines. However, this does not mean that OTC medicines are risk-free. It's important to follow the directions on the medicine label. You should also pay attention to any warnings about when and how to use them. Some medicines prevent disease. Others cure disease or relieve the symptoms of disease or injury. Still others are used to treat chronic conditions, such as a heart disease or asthma. Some of the most widely used medicines are described below. Vaccines. Vaccines are medicines that protect you from certain diseases. You probably received a vaccine for polio, measles, or other diseases during your infancy or childhood. Vaccines are also required before traveling to many foreign countries. We understood the word vaccine right now, kids, because in living in the time of COVID, how much we hear about the COVID vaccine and when you can get it. Antibiotics are medicines that kill or stop the growth of certain germs. Antibiotics can treat infections caused by bacteria such as strep throat. However, they cannot cure illnesses caused by virus such as colds or flu. That's what we get vaccinations for. Some medications help control heartbeat, reduce high blood pressure, and open block blood vessels. Some medications reduce pain, such as that from a headache, sore muscles, or broken bones. Aspirin is one example. So let's look at developing good character responsibility. Medicine labels tell you how to use drugs safely. For example, they tell you how much to take and how often to take it. Ignoring these directions can have serious consequences. Always use medicines responsibly. How medicines affect your body. All medicines have powerful effects on your body and mind. Your reaction to a medicine depends on these factors: the type and amount of medicine, the way the medicine enters the body. We're going to look at that on page 236 of figure 9.3. Other medicines you're taking, any allergies you have, such as I have friends who are allergic to penicillin, so therefore they cannot have any penicillin. So that's what they mean by allergies. You can have an allergy to a certain medication and you cannot take it. Negative reactions to medications. You may experience a reaction to some type of medications. A side effect is any reaction to a medicine other than the ones intended. Common side effects are drowsiness, dizziness, stomach upset, or a rash. Taking more than one medicine at a time can cause more dangerous side effects and may greatly increase or decrease the effects of one or both medicines. Sorry, I'm taking my supplements, which are not medicine. We'll talk about that when we get into nutrition next week. Always tell your doctor about all the medicines you are taking, including over-the-counter medications, such as, like, a reaction is like, when I'll take an aspirin, but I also take my allergy medications, my Zyrtec and my Flonase, I notice that my Zyrtec doesn't work as good if I take any, not ibuprofen, God, I can't think of the word right now. It's aspirin, but there's a technical word for aspirin that's going to bother me the whole time I'm doing this. It's not an antihistamine. Acetaminophen. Acetaminophen is the scientific word for aspirin. If I take any acetaminophen at the same time that I take my allergy medication, I can tell that the antihistamine of the Zyrtec doesn't dry me out as quick. It takes about another hour and a half longer. If you take medicine for a long time, you may develop a tolerance. Tolerance is a condition in which the body becomes used to the effects of a medicine and needs a greater amount to get the same side effect. We'll talk about that a little bit more when we talk next chapter about illegal drugs. And I hope I remember to talk about that a little bit with alcohol, because that can mess a lot of people up. If a medicine seems to have stopped working for you, ask your doctor or pharmacist about your options. Don't ask Dr. Google. Ask an actual doctor. Common ways of taking medicine include direct application to the affected area, swallowing, inhaling, or injecting. Give examples of medicines that are used in each of these four ways, which we will. Mucous membranes. Ointments, creams, or sprays can be applied directly to the mucous membranes or the eye, nose, and mouth. I'll ask you guys, what's some medication we take for that? Skin. Cream, patches, and lotions can be put directly on the skin. What are some things we take for that? Veins or muscles. Injections of medicine into a vein or muscle go directly into the bloodstream. These medicines work almost immediately. What are some of those we take now? Those are always basically done by a doctor, unless I'll talk about, like, if someone has an allergy to something and they go into an anaphylactic shock, we have to inject them with what's known as forgive me if I'm mispronouncing the word, an I think it's ephedrine pen, or what we call an EpiPen. Lungs. Inhaling medicine through the nose or mouth enables the drug to enter the lungs and then move directly into the bloodstream. Medicines that are also inhaled work quickly. We'll talk about stuff we take for that. Stomach and small intestine. Pills, powder, and liquid medicines are swallowed and move through your digestive system like food. Once absorbed, the medicine is absorbed into your bloodstream. It is carried to all parts of your body, including the place where it is needed over a period of time. So again, we'll talk about medicines and do that. Next page, drug safety. The Food and Drug Administration, the FDA, is a government agency that reviews all medicines sold in the United States to make sure that they are safe. It can often take several years to determine a medicine's long-term effects. The FDA then decides whether a medicine must be sold with a prescription or if it can be sold over the counter. Even medicines sold over the counter, however, are only safe when used as directed. Reading medicine labels. The FDA requires drug manufacturers to put certain information on medicine labels. The label must tell how and when to take the medicine, how much to take, and a special instruction for taking it. Figure 9.4 is an example of a prescription label. Figure 9.5 on page 238 is an example of a label on an OTC medicine. Label on prescription medicine. Prescription medicine labels usually show the name of the doctor who prescribed the medicine. Why is this information important? We see the prescription number, the name of the patient, the directions of the doctor, the name of the medicine, that's its scientific name, the date prescribed was filled, the initials of the pharmacist, the pharmacy name, address, and phone number, name of prescribing doctor, strength, number of refills, number of tablets in the container, and expiration date. Media watch. Medicine ads. Many drug companies now advertise new medicines in newspapers and magazines and on television. Examine one of these ads. What has the manufacturer told you about the medicine's purpose, dosage, or side effects, which I will create an ad, or I'm not going to create one. I'll create a YouTube video to show you guys that. I'm not going to create a YouTube video. I will download a YouTube video to show you that. There we go. Using medicine safely. Any drug that can do some good can also do some harm. For that reason, all medicines should be used with caution. To stay safe, follow these guidelines when taking any kind of medication. This would be lovely to take notes on. Ask your doctor or pharmacist if you are not sure with the OTC medicine to buy or how to use it. Take medicine only as directed on the label or as instructed by your doctor or pharmacist. Take medicine only for the intended purpose. If the medicine does not help, talk with a parent or another adult. You may need to call your doctor. Parents should keep medicine in child-resistant containers and place them out of reach of children. Throw away all medicine after they pass their expiration date. Finish all the medicine prescribed by the doctor for a bacterial infection. That's huge. If a doctor tells you, like when I've had strep throat or when I had bacterial pneumonia, even if you start feeling good, if they tell you to take it for 5 days and after 3 days you feel good, keep taking it. Label on over-the-counter medicine. Again, it shows the name of the product, the type of medicine, the main ingredient, the purpose of the medication, the direction for sale, caution and side effects, ingredients, amounts in package, manufacturer identification number, expiration date, and name and address of the manufacturer. The misuse and abuse of drugs. People can harm themselves if they misuse or abuse drugs. Drug misuse means taking medicine in a way that is not intended. Taking more or less medicine than the doctor instructed is an example of drug misuse. So is taking medication that was prescribed for someone else. Drug abuse means using drugs in a way that is unhealthy or illegal. My aides forgot to take sticky notes of what pages I want done. Examples of drug misuse and abuse. Misuse. Taking medicine for a shorter or longer amount of time than prescribed. Changing the amount of medicine taken without a doctor's approval. Taking more than one medicine without approval from your doctor. Using medicine that is prescribed for an earlier illness without a doctor's approval. Using medicine prescribed for someone else. Drug abuse. Using a drug that is illegal. We'll talk about that in just a second. Using a medicine or a for a non-medicinal purpose. Swallowing or breathing a substance that was not meant to enter the body. Using a drug in a way that physically, mentally, or socially is harmful. We're not going to do these review questions right now. We're going to do these. I'm going to combine lesson 9.3 and 9.2. So I'll put different questions on. Lesson 9.3, what are illegal drugs? Write a list of physical, mental, emotional, and social problems that people might develop using illegal drugs. We'll just talk about that as a class. We're going to learn about the dangers of illegal drugs and the main types of illegal drugs. So I was talking with a student today. Again, when we hear the word drug, when we talk about connotation, we just think of drug as something illegal. Marijuana, cocaine, heroin, methamphetamines, things that are not good for us. But as we learned in the previous chapters, that over-the-counter and prescription medication are drugs. So drugs are fine for you as long as used right, but there are illegal drugs. We're going to learn about words like withdrawal, stimulant, depressant, narcotic, hallucinogen, inhalant, marijuana, and anabolic steroids. My kids didn't do a great job copying these pages. Rubble, rubble. The danger of drug abuse. Any use of illegal drugs, as well as the abuse of legal medicines, can seriously harm the user and even cause death. Sometimes these effects occur the first time the drug is used. Drug abuse damages the relationships and harms performance in school or at work. People who use illegal drugs may get into trouble with the law, ruining their future plans. So when we talk about the abuse of legal drugs, that's why we don't allow you guys to have cough drops and other things. Because again, you can even take too many cough drops or cough medicine at once and still mess your brain up like you would if you took an illegal drug. Drug abuse often leads to addiction. Addicts have a psychological and physical need or a dependence for the substance they are abusing. Ending a drug dependence is difficult and a painful process. The user must remove all traces of the drug from the body. This causes withdrawal or a series of mental and physical symptoms that occur when a person stops using an addictive substance. These symptoms may include headaches, chills, vomiting, memory loss, hallucination, and severe anxiety. Because withdrawal can be dangerous, this process should be medically supervised. After the drug has been removed from their bodies, users must deal with the psychological dependence by learning to control their cravings. Teens who value their health avoid tobacco, alcohol, and other drugs. What are some healthy activities that you and your friends enjoy? And then I'm going to ask, what happens if you abuse alcohol and tobacco and other drugs? How can that screw that up? Now, back to withdrawal. Understand that it's not just nicotine, tobacco, alcohol, and illegal drugs. We can get addicted to food. We can get addicted to TV. We can get addicted to shopping. Again, all kinds of stuff people get addicted to, and you have to go through the withdrawals of getting rid of that. Before we start talking about stimulants, let's look at caring. If you suspect that a friend is using illegal drugs, you can help. Try talking to a trusted adult, such as a parent or a school counselor or a teacher. Hello. If no one is available, try gathering information about the harmful effects of the drugs. Then share the information with your friend. You may be saving a life. Stimulants are drugs that speed up the body's functions. They cause blood pressure to rise, the heart to beat faster, breathing rate to increase, and the pupils of the eyes to dilate. Stimulants may be swallowed, smoked, inhaled, or injected. Amphetamines and cocaine are two types of stimulants. Both are highly addictive and very dangerous. Amphetamines are pills like steroids, and cocaine we know is that white powder that people put up their nose. People can also do what's known as crack cocaine, which is it's another type of cocaine that people can snort as well, or they can shoot up with a syringe. Again, those are illegal stimulants that you guys obviously shouldn't be using. Things like caffeine is also a stimulant, so this comes back to when we talked about not all drugs are considered illegal. Caffeine that you get from coffee or pop or even a lot of chocolate can be a stimulant. It can do the same thing, but it's not as bad as cocaine and amphetamines. Amphetamines are sometimes called uppers or speed. Doctors may prescribe them to treat obesity, sleep disorders, or attention disorders in children. All others are illegal. Yeah, I have no idea how amphetamines treat sleep disorders. We're going to look that up after I read this because that fascinates me. Attention disorders, things like ADD and ADHD. They prescribe things like Ritalin, or we allow kids to have coffee, to slow down their attention deficit disorders. Again, how that works, I don't know. We'll look that up. Any use of amphetamines can have dangerous side effects. These include headaches, blurred vision, dizziness, restlessness, anxiety. At high doses, drugs can cause more severe side effects, such as loss of coordination, irregular or rapid heartbeat, physical collapse, heart failure. Anything like that, kids, can kill you. Long-term use of amphetamines can lead to several mental problems. Injecting or inhaling amphetamines can cause blood pressure to rise quickly, leading to seizure or death. And I wish my kids didn't put that on the page so I could see what this is talking about. I see a finger. Cocaine and crack. Cocaine is an illegal stimulant drug that is highly addictive. Its effects are unpredictable and very dangerous. Even the first use of the drug can cause a user's blood pressure and heart rate to soar to levels that result in a fatal seizure or heart attack. Other dangers of cocaine use include sleepiness, loss of appetite, nervousness, and suspicion, infection with HIV or hepatitis B if cocaine is injected. I'll explain that in a minute. Serious or fatal burns from preparing crack or freebase, a form of cocaine that is smoked. Back to the killing, or death from it. Sorry, not really killing. Former coworker I had at Kmart, her youngest son, very good athlete at South High, did cocaine once at a party and had a heart attack and died. So, I mean, kids, that's something that you can do it once, and that thing will speed up your heart so quick you'll have a heart attack. The reason that you can get HIV or hepatitis B from cocaine or crack is sharing needles. Unfortunately, people who get into that habit aren't always like, oh, well, I injected this harmful substance in my body. Here, you want to try some? Sure, but I need a clean syringe. No, what happens is they inject that into their body, and because there's traces of someone else's saliva, their blood, their bodily fluid on that, that's where people can get things like HIV, which leads to AIDS or hepatitis B. You're going to ask me what hepatitis B is. We'll look that up after I'm done reading. Depressants. Depressants are drugs that slow down the body's functions and reactions. They cause the heart rate and blood pressure to drop. Breathing and brain activity also slow down. Alcohol is an example of a depressant. The two other main types of depressants are barbiturates and tranquilizers. A doctor may prescribe them to reduce anxiety and help people sleep. However, they are highly addictive. The dangers of depressant use includes lack of coordination, slurred speech, drowsiness, poor judgment, confusion, and addiction. When combined with alcohol or other drugs, they can be deadly. You're going to make me look up the word barbiturates. I'll look it up after we read. Remind me if I forget. Narcotics are certain drugs that relieve pain. They include morphine, codeine, heroin. Doctors may prescribe morphine to reduce severe pain. For example, it may be used after surgery or serious injury. Some prescriptions, cough syrup, and painkillers contain codeine. Legal narcotics are strongly addictive and must be used very carefully. So morphine and codeine, heroin, those are, again, heroin I don't think is given anymore for pain, but morphine, which was known as laudanum, back in the Old West days, people would take it for pain. Again, codeine, that's what cough syrup and a lot of cough drops have. That's why you can't take a bunch of them at once. And then heroin, again, is an addictive drug that people shoot up. Again, I don't think heroin is legal for medicinal use anymore. And obviously, right here, heroin is dangerous and has no legal uses. Heroin users risk unconsciousness or death. People who inject heroin also risk HIV infection from shared needles. Hallucinogens are illegal drugs that cause users' brains to distort images and to see and hear things that aren't real. In other words, these drugs cause hallucination. Users often behave strangely or violently. PCP, angel dust, LSD, acid are two very dangerous hallucinogens. People who use PCP or LSD often think they have super strength. They may try dangerous acts that can lead to death. People who use these drugs sometimes have delayed effects called flashbacks. Long after they stop using the illegal drugs, the person has no control over when a flashback can occur. Other hallucinogens, called MDMA or ecstasy, is also a stimulant. Users may experience confusion, depression, and nausea. Continued use can result in permanent brain damage. That's going to be our Thursday project. You guys are going to draw and color some more about why drugs are not good for us to use. Inhalants. Inhalants are substances whose fumes are inhaled to produce hallucinogens. Most inhalants are common household products not meant to be taken into the body. If swallowed, these would commonly cause death. When inhaled, they can fill the lungs and suffocate the user. They also kill brain cells, cause permanent brain damage, or a comatose condition. This can happen with the first usage. Things like airplane glue, certain markers, a certain smell can cause inhalants. Paint. Again, that's why spray paint, you don't spray paint stuff that's not in a well-ventilated area or without a mask, which we're all used to wearing now because of COVID. Again, you do not paint in an unventilated area. You open up a window, a garage. Because again, inhaling those fumes can get you high. Marijuana. Marijuana is an illegal drug that comes from a hemp plant. Marijuana is also known as pot or grass. It increases heart rate and may cause panic attacks. It also interferes with concentration and memory. People who use marijuana may lack energy. They often lose interest in activities they once enjoyed. Users lack coordination, injure themselves more often, and are unable to react well in emergencies. Long-term use may cause damage to the brain. People who use marijuana may be more likely to try other more dangerous drugs. We're not going to do the skit. And my kid screwed up steroids, the page. Sorry. Steroids are a part of a hormone that doctors usually prescribe. If you take them illegally, athletes do it to increase their muscle mass and their weight, but they should never be used for this purpose. Users can get aggressive and deeply depressed. Steroids can mess up our sexual development in both males and females. It can also cause brain cancer and heart attack. Steroids shrink. They can make your head grow larger, your cranium. They can give you back acne. They can also shrink the male anatomy. So that's not a reason to take steroids. Again, steroids are only prescribed by a doctor. You should not take anabolic steroids. So, sorry, my kid screwed up the last page. If this took too long, depending on what else we're going to watch, we won't do the questions. But on Thursday, you guys are going to create a Say No to Drug little page and why we should not use drugs. As always, children, if you have any questions, please message me on Schoolology. Please unmute yourself in remote learning, or please raise your hand in class. Thank you very much, Pirates, and have a super sparkly day.